Needing hip surgery at the age of 25 or even younger. For many athletes and active young people, a complete hip replacement not an option because of the long-term risks a bit later in life.
Now there's a new procedure that can eliminate the pain without the need for multiple surgeries. Health reporter Haley Hernandez explains how it works.
21-year-old Ashley Frankenthor has spent most of her young life on the move.
Well, I played soccer, softball, I did gymnastics, cheerleading.
Her favorite sport, volleyball.
I was very competitive and always needed to be aggressive.
But hip pain sidelined the promising athlete in high school.
I was in so much pain to where I could not walk or do anything.
It took a few years, but Ashley finally got a diagnosis. She had hip dysplasia, or an abnormal hip joint. Doctors don't know what causes it, but if untreated, it can lead to severe arthritis.
And once a hip is arthritic, really the only treatment is a hip replacement.
The problem, hip replacements only last about 20 years for elderly patients, but as many as 35% of patients younger than 50 have to do it again in 5 years. So young patients like Ashley would either have to wait in pain for years or have the surgery and multiple revisions.
And each time that a hip replacement is revised, the outcomes are not as good.
Dr. Joel Williams offered Ashley a different option, hip preservation surgery. He essentially cut her pelvis and shifted her bone up so the hip joint aligned with the socket. It can postpone or even eliminate the need for a hip replacement down the road. The recovery hasn't been easy, but Ashley says it's worth it.
I feel like a whole new person after it.
Hip dysplasia affects many more women than men. The environment of a mother's womb seems to play a role in predicting if some babies will develop hip dysplasia, as does a breech birth. Haley Hernandez, KPRC Channel 2 News.
All right, let's talk a little bit of weather.